afternoon program. I think we have all had a good time over the lunch period. We've taken our short walks after having that jollof rice. And yes, I guess, yeah. Um, so for this afternoon, we will be looking into mental health challenges in young adults and children. I'll just be giving a short time to run through it. And I just find it will be unfair to talk so much about physical health, um, you know, diabetes, high blood pressure, all of that, without mentioning mental health. Because what affects the mental or physical health also affect the mental health. They go hand in hand. And when you look at what is happening in our society today, you will also agree with me that it's mental health is top on the agenda. And again, and it's something that can affect anyone, you know. And I know as Christians, or even from our own background, you see mental health is something that is a taboo. People don't want to talk about it. But just like Dr. Chidi said earlier, you know, it's always very important to find a space or somebody that you can talk to when you are overwhelmed with whatever is going through in your life. And knowing that, you know, the challenges in mental health, they're so broad, so we don't have enough time to go through it. So for the purpose of the discussion this afternoon, I will just focus on depression. Okay, so depression is what I'm going to look at. And depression is something that affects all ages. It can be adults, it can be young adults, it can be older adults, and it can be children. So what do we know about depression? And how does it affect us? So it is a long-standing mood disorder, and it affects few weeks, and it's something that can last for few weeks or months, or rather than maybe just a few days. So when you feel sad or you are unhappy, it's something that can be a couple of days. I mean, you might be upset about something, you know, because sometimes people do mix it with depression. Depression is something that it can last for weeks and can even extend into months. So much that you need to ask for professional help. It affects your ability to do everyday things. So such thing may be your sleep. Your sleep may be affected. You can either sleep too much or you can sleep less. Or it can also affect your work. You know, some people are so low or down in their spirit that going to work becomes a burden. They can't even get up to work, go out to work. They don't want to attend to their personal care. They don't feel like washing. They don't feel like doing anything. It can also affect social relationships, you know, and appetites and other pleasurable activities. So it's something that is very, very important that we have to, you know, think about. And again, depression can affect people of all ages, including children. You know, also, even it's not something that is new in our time. Even in the Bible, you know, there are lots of Bible characters that also suffer from depression, low mood. People like Job, you know, David. You know, we have, you know, there are several of them. You know, they felt so down in their spirit, and to the point that they wanted to commit suicide, or somebody even did. You know, and that is what depression can do. So it is one of the most common mental health illness, and it affects one in 6 of us. So every 6 person, you might see one that has a depression. And an individual may be diagnosed with mild, moderate, or severe depression. So there are different categories to that. So mild, moderate, and severe depression. So I'll just go into that quickly. So we have major depression is also known as clinical depression. So that's something like you can call melancholic, which is severe. We also have something like what we call a psychotic depression, and also have postnatal depression. So what is melancholic? So it's when losing touch, you know, I mean, so go. Just a minute. Just a minute, please. My laptop is. Okay, so the melancholic depression, it often lasts for, it affects physical symptoms. It's something like physical symptoms may include slowing down of your speech, your thoughts, and your movements. feeling sad, down, or miserable, and again, completely unable to enjoy anything. So that is different from when you feel sad, for a moment, or somebody upsets you. It lasts for long, and it can affect your physical activities and all that. So also, we have what we call psychotic depression. Psychotic depression is when somebody is unwell to the extent that they lose touch with reality. And this can come in various forms. It can be delusional, it can be, hallucinations, paranoia. And again, it's depression that sets into that because it's, once it's not attended to on time, it leads to a psychotic episode when people may begin to think that somebody is following them, they want to poison them, they might think that a relative is doing something bad to you, or whatever is happening in my life is just because of this. So you just attribute everything into that. But it's depression that is a psychotic depression. So again, somebody might feel that you have special powers. You know everything. Some people get to the extent that they think that they are the God. So it can come in various forms, and it's very important that we be able to identify some of these signs or symptoms and to be able to take a quick treatment for that. Yeah. So antenatal or postnatal depression. This is something that's more common among women. So it's a depression which develops during pregnancy and after birth. So the antenatal happens during pregnancy. Postnatal is something that happens after a birth. And again, when you think about it, after carrying the baby for a month, it affects all your hormonal systems, and things do go wrong sometimes. And when you have the babies, if you don't have the right support, for people that you can talk to, it can be overwhelming, waking up in the middle of the night, baby crying and all that. So that can set into that form of depression. Sometimes they call it the baby blues, which include mood swings. So people become so irritable. Every little thing makes you upset. You get angry with people so easily. Loss of appetite. You don't want to eat. Irritability, like I said, self-neglect, and become tearful, and you blame yourself for everything. Every little thing makes you cry. That's that type of depression. And also, what are the causes of depression? It's a multiple things. It can be genetic. It can be a major life event. Sometimes people suffer some form of trauma. Trauma can be sexual abuse, it can be physical abuse, or emotional abuse. Even as growing up as a child, people say things to you that you do not internalize it, or sometimes people are being molested and all that, and because they bottle it up and they have not created that space to talk and openly talk about it, so it does affect their mood to the extent that they become so aware and they are unable to do anything. So they also have, it can be family history. Somebody in the family may have depression, and like I said, because it's genetic, sometimes people can pick that up. And also use of recreational drugs and alcohol. We know, and again, one needs to be very careful, again, with young adults. Some of them, they've been under our roof for so many years. They do go out and they live independently, and they are being influenced by other people to try one form of substance and the other. And how it affects Mr. A might not be the same thing as it affects Mr. B. So sometimes you might see some people that have been using drugs for several years, and they are able to function and cope well with it, but other people might try one thing, and they just trip. So as parents, we need to be very mindful of that, and to pay particular attention to our young ones. Some of the things that they can, and once somebody starts to use drugs and all that, money goes so fast, So, or sometimes their behavior will just change all of a sudden, or they may be withdrawn, they may not want to do, and even their physical appearance might do change, So that's why when you have young ones at home who are not under your roof anymore, pay particular attention, and maybe they've been talking to you freely before, all of a sudden they change in behavior, they don't want to share anything with you, just, check with them, and then you can support them. What is it that we can do to help to treat and manage depression? Now, the treatment comes in about 3 categories. We have the psychological treatment, and we also have pharmacological treatment, and also what we call lifestyle changes. So with the psychological treatment, you may have talking therapies, which is quite good. Talking therapies is all led by a team of psychologists as well, where you can openly talk about what is going on, because sometimes it's good to speak to a professional, and it doesn't show that you are weak, because again, this happens more in men. You might feel that, why am I seeing a therapist, somebody to sit with me and be talking to you, and because of the egos, men ego, and you don't want to do that. It's not an indication that you are weak, but when you need help, you need to seek help, and you need to make sure that you access that. Otherwise, it can gradually progress into something that it completely out of hand. So talking therapy is good. Cognitive behavior therapy is one of them, which they call CBT. Again, it's about changing your behavior, how you perceive things. Some of the negative things are being hopeless and life not worth living and all that. These are the people that they will change that, and they give you some techniques and some coping mechanisms so that you can reshape your life, and also mindfulness and also interpersonal therapy. So that's the category of that treatment. Medication for depression, there are several of them that you can take, and also there's mood stabilizers for those, because depression sometimes they have two extremes. There's low and the end side of it is when you are extremely excited, hyperactive, you want to spend 1,000 within the, you just spend recklessly. There's no limit to anything. You want to do extreme things. So that's what the mood disorder. So it's the end of it, so that people feel elated in mood, and also they can be very low. So you can have medication like what they call mood stabilizer to kind of change that. Again, the medication targets the hormones in the brain, the chemical imbalance in the brain. So that's what the medication does. And also, lifestyle changes. This will include regular exercise. I think Dr. Chidi said about that, how important it is that we eat healthy food, we exercise regularly. Again, we change our sleep pattern. Also, make sure that you find somebody that you can talk to, so that you don't just feel that you are alone by yourself. So lifestyle changes, and again, with something like a gathering that we have here, like a church community, we support each other, because some other people in the community, they are so lonely, they hardly see anybody. They are just in their own homes. They don't have friends. And what they then do is that instead of using a positive way of coping, they tend to be using like alcohol, and they do some other dangerous things. So generally, so that's what we can do in terms of help that is available for us. And like I said earlier, you must not feel that you're alone. You must seek help. And when you notice something like that, whoever is close to you, talk to them. And I believe that the Lord will help us. And so I don't know if there's any question, because it's just a short presentation, just to give us awareness about mental health. And, if there's anything that you want to ask that is not clear, we have a few more minutes that we can. I'm happy to take your questions. Any? It seems I've done an excellent job there. If no one, yeah? Okay. Thank you very much. My prayer is that we will continue to live both a healthy life, and God will continue to help us so that we can maintain both physical and mental health. In Jesus' mighty name I pray. Amen. Thank you.